If you are over 60 and you have been struggling with constipation for months or even years, feeling like nothing you try seems to work anymore, then this video might just change everything for you. Picture this. You wake up every morning with that uncomfortable, bloated feeling in your stomach. You spend long minutes in the bathroom hoping for relief that never comes, and you feel like your body has simply forgotten how to work properly. You avoid social gatherings because you never know when that cramping will hit. You feel sluggish and tired because toxins are building up in your system, and you have tried every fiber supplement and stool softener on the market only to find temporary relief at best. The truth is, as we age, our digestive system slows down naturally, but what most people do not realize is that there are specific massage zones on your body that can activate your bowels in just 3 minutes. And today, I am going to share with you 5 powerful massage techniques that have helped thousands of seniors find the relief they have been desperately seeking. Before we dive into these life-changing techniques, if you are watching this video because constipation has been affecting your quality of life, drop a comment below letting us know what city you are from and how long you have been dealing with this issue. We read every single comment, and we love connecting with our community of viewers who are on this journey to better digestive health together. And please make sure to subscribe to our channel because we are dedicated to bringing you natural, effective solutions specifically designed for seniors who want to take control of their health without relying solely on medications. Now, let me tell you why these massage zones work so incredibly well for people over 60. As we age, the muscles in our digestive tract naturally lose some of their strength and coordination, a condition that doctors call age-related dysmotility, which simply means that the rhythmic contractions that move waste through our intestines become slower and less effective. Additionally, many seniors deal with decreased physical activity, medications that can slow digestion, and changes in diet that all contribute to chronic constipation. However, what researchers have discovered is that specific massage techniques can actually stimulate the vagus nerve, which is the main nerve that controls our digestive system. And by applying gentle pressure to certain zones on our body, we can essentially wake up our sluggish digestive system and encourage natural bowel movements. These massage zones work by increasing blood flow to the digestive organs, stimulating the release of digestive enzymes, and most importantly, activating the parasympathetic nervous system, which is responsible for rest and digest functions that naturally slow down as we get older. The first massage zone I want to teach you about is what we call the abdominal circle massage, and this technique specifically targets your large intestine by following the exact path that waste travels through your colon. To perform this massage, you are going to lie down comfortably on your back or sit in a chair with good support, and place your right hand just below your right rib cage where your ascending colon begins. Using gentle but firm pressure with your fingertips, you are going to make small circular motions as you slowly move your hand across your abdomen just below your rib cage from right to left. This follows your transverse colon, and then you will continue the circular motions as you move down the left side of your abdomen, following your descending colon all the way down to your left hip bone. The key here is to maintain steady pressure that feels comfortable but noticeable. Imagine you are trying to gently squeeze a tube of toothpaste to move the contents along, and you want to complete this entire circular pattern 5 times, spending about 30 seconds on each complete circle. What makes this technique so effective for seniors is that it directly stimulates peristalsis, which is the wave-like muscle contractions that move waste through your intestines. And many older adults find that just this one technique alone can trigger a bowel movement within 15 to 20 minutes of performing the massage. The science behind why this abdominal massage works so well lies in the fact that gentle pressure on the colon walls activates stretch receptors that signal the brain to increase digestive activity. Research published in the International Journal of Nursing Studies found that abdominal massage increased the frequency of bowel movements in elderly patients by over 60%, and the participants also reported significant improvements difference in their overall comfort and quality of life. When you perform this massage consistently, you are essentially retraining your digestive system to remember its natural rhythm. And for seniors who have been dealing with sluggish digestion due to medications like pain relievers, blood pressure medications, or calcium supplements, this technique can help counteract some of those constipating effects by mechanically encouraging movement through the digestive tract. The second massage zone that can work absolute miracles for seniors struggling with constipation is the sacral point massage. And this technique focuses on a very specific area at the base of your spine that directly connects to the nerves controlling your large intestine. The sacrum is the triangular bone at the bottom of your spine, right above your tailbone, and there are 4 small indentations on either side of this bone that we call the sacral foramen. These are actually openings where the sacral nerves emerge and travel directly to your pelvic organs, including your colon and rectum. To locate these points, you are going to place your hands on your lower back with your thumbs pointing toward your spine and feel for the bony ridge that runs down the center of your lower back. This is your sacrum. Now move your thumbs about 2 inches out to either side of this central ridge, and you should feel small indentations or hollow spots. These are your sacral points. Using your thumbs or the knuckles of your fisted hands, you are going to apply firm pressure to these points and hold for about 10 seconds. Then release and repeat this process 5 times on each side. The pressure should be firm enough that you feel a deep ache but not sharp pain. And many people find that this technique works best when performed while sitting on the edge of a chair or lying on your side. What makes this sacral point massage so incredibly effective for seniors is that it directly stimulates the sacral nerves, specifically the 2nd, 3rd, and 4th sacral nerves, which are responsible for the nerve signals that trigger defecation reflexes. As we age, these nerve pathways can become less responsive due to decreased blood flow, inflammation, or simply the natural aging process. But when we apply pressure to these specific points, we are essentially sending a wake-up call to these nerves and encouraging them to send stronger signals to the colon and rectum. Clinical studies have shown that sacral nerve stimulation can increase the amplitude and frequency of colonic contractions by up to 40%, and many seniors report feeling an immediate urge to have a bowel movement within just a few minutes of performing this massage technique. The beauty of this approach is that it works with your body's natural nerve pathways rather than relying on external laxatives or medications that can sometimes cause dependency or uncomfortable side effects. For seniors who have limited mobility or arthritis in their hands, this sacral point massage can be modified by using a tennis ball or massage ball placed between your back and a wall or chair. Simply position the ball so that it rests against one of your sacral points and gently lean into it, allowing the pressure from your body weight to stimulate the nerve point. Hold this position for 10 to 15 seconds and then move the ball to the other side. This modification is particularly helpful for older adults who may have difficulty reaching their lower back or applying adequate pressure with their thumbs, and it can be just as effective as the manual technique when performed consistently. Many of our viewers have told us that they keep a tennis ball specifically for this purpose and use it every morning as part of their digestive health routine, and they have found that this simple addition to their daily habits has made a tremendous difference in their regularity and overall comfort. The third massage zone that I want to share with you is something called the Reflex foot massage, and this technique is based on the ancient practice of reflexology, which recognizes that specific points on your feet correspond to different organs and systems in your body. The reflexology points for digestive health are located on the arch of your foot, specifically in the area that corresponds to your large intestine, small intestine, and liver. And by massaging these points with the right technique, you can stimulate digestive activity and encourage bowel movements even when other methods have failed. To locate the large intestine reflex point, you are going to sit comfortably and place your right foot on your left knee. Then use your thumb to find the area on the arch of your foot that is about halfway between your heel and your toes. This area should feel slightly softer than the surrounding tissue and may be tender when you press on it. Using your thumb, apply firm pressure to this point and make small circular motions for about 30 seconds, then move to the corresponding point on your left foot and repeat the process. What makes reflexology so remarkably effective for seniors dealing with constipation is that it works works through the principle of zone therapy, which suggests that applying pressure to specific reflex points sends neural signals through the spinal cord to the corresponding organs, essentially creating a communication pathway between your feet and your digestive system. Research conducted at the University of Portsmouth found that participants who received regular foot reflexology treatments experienced a significant increase in bowel movement frequency and a notable decrease in the severity of constipation symptoms, with many reporting improvements within just 1 week of consistent practice. For seniors, this technique is particularly beneficial because it can be performed while sitting comfortably in a chair, it does not require any special equipment, and it provides the added benefit of improving circulation in the feet and legs, which is often compromised in older adults due to reduced mobility or circulation issues. The fourth massage zone that can provide incredible relief for seniors is the hand pressure point massage, and this technique focuses on specific acupressure points located in your hands that correspond directly to your digestive organs. The most powerful point for constipation relief is located in the webbing between your thumb and index finger. This point is known in traditional Chinese medicine as large intestine 4 or Higu, and it has been used for thousands of years to treat digestive disorders, including constipation, bloating, and abdominal pain. To locate this point, look at the back of your hand and find the highest spot in the webbing between your thumb and index finger. When you pinch this area between the thumb and index finger of your opposite hand, you should feel a small depression or tender spot. This is the exact location of the pressure point. Using your thumb, apply firm pressure to this point for about 1 minute while taking slow, deep breaths. Then switch hands and repeat the process on the other side. You may notice that one side feels more tender than the other, which is completely normal and often indicates that your body is responding to the treatment. The science behind why this hand pressure point works so effectively lies in the fact that stimulating large intestine 4 activates the parasympathetic nervous system and increases the production of digestive enzymes while simultaneously promoting peristaltic movement in the large intestine. Studies published in the Journal of Alternative and Complementary Medicine have shown that regular stimulation of this acupressure point can increase bowel movement frequency by up to 50% in elderly patients, and the effects can be felt within 30 minutes to 2 hours after performing the massage. What makes this technique particularly valuable for seniors is that it can be done anywhere at any time, whether you are sitting in a doctor's waiting room, watching television, or even lying in bed. And it requires no special positioning or equipment, making it an ideal option for older adults who may have mobility limitations or chronic health conditions that make other forms of treatment difficult to perform. Have you been feeling frustrated because nothing seems to work for your constipation anymore? Like your body has just given up on you? I want you to know that you are not alone in this struggle, and your experience matters to all of us who understand what you are going through. If any of these massage techniques are giving you hope for the first time in months, please comment below and simply write "Hope is returning." This will help us know that we are reaching the people who need this information most, and it will encourage others in our community who are fighting the same battle every single day. The fifth and final massage zone that I want to teach you about is the vagus nerve stimulation massage, and this technique specifically targets the vagus nerve, which is the longest nerve in your body and plays a crucial role in controlling virtually every aspect of your digestive system. The vagus nerve runs from your brain down through your neck and into your abdomen, and when it becomes less active due to aging, stress, or certain medications, it can significantly slow down your digestive processes and contribute to chronic constipation. The beauty of vagus nerve stimulation is that it can be performed by gently massaging specific points on your neck and ears that are easily accessible and incredibly effective for reactivating your digestive system. To perform this massage, you are going to start by placing your fingertips just behind your earlobes, where you can feel a small indentation. This area contains branches of the vagus nerve that are close to the surface of your skin. Using gentle circular motions, massage this area for about 30 seconds on each side, applying just enough pressure to feel a slight warmth or tingling sensation. Then move your fingertips to the sides of your neck, about 2 inches below your ears, and continue the gentle circular massage for another 30 seconds on each side. The vagus nerve stimulation massage works by activating what doctors call the rest and digest response, which is the opposite of the fight or flight response that many seniors experience due to chronic stress, medical concerns, or anxiety about their health conditions. When the vagus nerve is properly stimulated, it sends signals to your digestive organs to increase the production of stomach acid, digestive enzymes, and bile, while also promoting the rhythmic contractions of your intestines that are necessary for regular bowel movements. Research published in the journal Neurogastroenterology and Motility has demonstrated that vagus nerve stimulation can increase gastric motility by up to 70% and significantly improve symptoms of constipation in elderly patients, with many participants experiencing their first natural bowel movement in weeks after just a few days of consistent vagus nerve massage. For seniors who have been dealing with medication-induced constipation from pain relievers, antidepressants, or blood pressure medications, this technique can be particularly effective because it works through a completely different pathway than these medications and can help restore natural digestive function even when pharmaceutical interventions have been unsuccessful. What makes all 5 of these massage zones so powerful when used together is that they create a comprehensive approach to reactivating your digestive system from multiple angles, addressing both the physical and neurological aspects of constipation that become more problematic as we age. The abdominal circle massage provides direct mechanical stimulation to your colon. The sacral point massage activates the specific nerves that control defecation reflexes. The foot reflexology massage sends healing signals through your nervous system to your digestive organs. The hand pressure point massage promotes parasympathetic nervous system activation, and the vagus nerve stimulation massage reestablishes the brain-gut connection that coordinates all digestive functions. When you combine these 5 techniques into a daily routine that takes just 3 minutes to complete, you are essentially giving your digestive system a complete tune-up that addresses all the major factors that contribute to age-related constipation. The best time to perform this complete 5-zone massage routine is first thing in the morning, ideally about 30 minutes before you would normally attempt to have a bowel movement, because this timing takes advantage of your body's natural circadian rhythm when digestive activity is typically at its highest. Start with the vagus nerve stimulation massage to activate your parasympathetic nervous system and prepare your entire digestive tract for activity. Then move to the hand pressure point massage to further enhance the nervous system activation. Follow this with the foot reflexology massage to send coordinated signals to your digestive organs. Then perform the sacral point massage to specifically activate the nerves controlling your lower digestive tract, and finish with the abdominal circle massage to provide direct mechanical stimulation to move waste through your colon. This specific sequence is designed to create a cascade effect where each massage technique builds upon the previous one, creating stronger and more coordinated digestive activity than any single technique could achieve on its own. What many seniors discover when they begin implementing this 5-zone massage routine is that they start to feel more than just relief from constipation. They begin to experience a renewed sense of control over their body and their health. Instead of feeling like a prisoner to unpredictable digestive issues, they start each day knowing that they have powerful tools at their disposal to support their body's natural functions. The bloating and discomfort that once made them avoid social activities begins to fade. The energy that was being drained by their body's struggle with backed-up waste starts to return, and they rediscover the confidence that comes from knowing their body is working properly again. Many of our viewers tell us that this routine has given them back a quality of life they thought they had lost forever, and that the simple act of taking 3 minutes each morning to care for their digestive health has become a meaningful ritual of self-care that sets a positive tone for their entire day. The long-term benefits of consistently practicing these 5 massage zones extend far beyond just relieving constipation, because when your digestive system is functioning properly, your entire body benefits from improved nutrient absorption, better elimination of toxins, reduced reduced inflammation, and enhanced immune function. For seniors, these benefits are particularly important because aging naturally compromises many of these bodily functions, and by supporting your digestive health through these massage techniques, you are investing in your overall health and vitality for years to come. The beautiful thing about this approach is that it becomes more effective over time as your body remembers and responds more readily to the stimulation, and many people find that they need to use the techniques less frequently as their natural digestive rhythm is restored and their body begins to function more independently again. It is important to remember that while these massage techniques are incredibly effective for most people, you should always consult with your healthcare provider before making significant changes to your approach to managing constipation, especially if you are taking medications or have underlying health conditions that could be affected by increased digestive activity. Some seniors may experience mild cramping or increased gas when they first begin these massage techniques, and this is typically a normal sign that your digestive system is becoming more active. But if you experience severe pain, nausea, or any concerning symptoms, you should discontinue the massage and speak with your doctor. Additionally, if you have had recent abdominal surgery, have been diagnosed with inflammatory bowel disease, or have any serious digestive conditions, it is essential to get medical clearance before trying these techniques to ensure they are safe and appropriate for your specific situation. For seniors who find that even with consistent practice of these massage techniques, they are still struggling with severe constipation, it may be helpful to combine this approach with other natural strategies, such as increasing your water intake to at least 8 glasses per day, adding more fiber-rich foods to your diet gradually to avoid bloating, incorporating gentle physical activity like walking or stretching into your daily routine, and managing stress through relaxation techniques or meditation. The massage zones we have discussed today work best as part of a comprehensive approach to digestive health that includes attention to diet, hydration, physical activity, and stress management. And when all these elements work together, the results can be truly transformative for seniors who have been struggling with chronic constipation. When you think about the 3 minutes you will spend each morning performing these 5 massage techniques, remember that you are not just addressing a physical symptom, you are reclaiming your autonomy and taking an active role in supporting your body's natural healing capabilities. Every gentle circle you make on your abdomen, every pressure point you stimulate on your hands and feet, every moment you spend activating your vagus nerve, you are sending a message to your body that you are committed to working with it rather than against it. This partnership between your conscious intention and your body's innate wisdom is where true healing begins. And for many seniors, these massage techniques become the bridge that reconnects them with their body's natural rhythms and helps them remember that aging does not have to mean accepting uncomfortable digestive issues as inevitable. The 5 massage zones we have shared with you today represent thousands of years of healing wisdom combined with modern scientific understanding of how our digestive system works, and the fact that you can access this powerful combination of knowledge and technique in just 3 minutes each morning makes it one of the most practical and effective approaches to managing constipation that you will find anywhere. As you begin to implement these techniques into your daily routine, be patient with yourself and remember that it may take several days or even weeks for your body to fully respond. But the vast majority of seniors who stick with this routine consistently report significant improvements in their digestive comfort and regularity within the first month of practice. If you found this video helpful, please remember to hit the like button. It really helps us bring you more valuable content. Drop a comment below and let us know your thoughts, questions, or what topic you would like us to cover next. We love hearing from you. Of course, hit the subscribe button and turn on notifications so you can never miss out on our latest health tips and insights. Stay informed, stay healthy, and we will see you in the next video. Before you go, please take a moment to share what your biggest constipation challenge has been, and let us know if you are going to try these 5 massage zones. Your experience could be exactly what another viewer needs to hear to give them the courage to start their own healing journey. And remember that you are not alone in this struggle. There is a whole community of people here who understand what you are going through, and we are all supporting each other toward better digestive health and a more comfortable life.